Hey, everybody. I'm Amie Clark with theseniorlist.com, and today I'm here with Cynthia, Nurse Cynthia.
Yes.
And we are talking today about medication management in assisted living communities.
Yes.
And one of the reasons I wanted to make this video and talk about this with our visitors is because I have a personal connection, a personal story about medication management with my own grandmother who lived in assisted living. And she was adamant when she moved in there that she would manage her own medication. And she did that for quite a while. And it worked well for a little while until it didn't. And then it just turned into this daily stressor. And, as her person who helps her with everything, it just turned into this momentous task where I was daily monitoring her medications. I was worrying about it. I was afraid that she wasn't doing it correctly, but she refused to give up that piece, that control in her life. So it was a real struggle. And I know that I'm not the only one who went through this.
Yes, absolutely.
As you can attest.
Yes, yes. Medication management is oftentimes that one of those last forms of independence that we hang on to. We've lost a lot typically prior to moving into an assisted living community, and being able to feel responsible for our own medications is very important. And it's a tough discussion to have with our loved ones, with residents, and it's a tough road to navigate, and it needs to be done with a lot of compassion and hopefully as a process, going through some different options and trying to problem solve to make sure that they are receiving the medications that they need in a safe manner that really works for them and allows them to have some choice and some dignity and independence.
Yeah. And as a nurse who has worked in assisted living for so long, I know that you have seen this journey and you've gone through this journey with so many people. So today we're going to learn more about that. So first of all, tell us what medication management is in assisted living, and maybe even for people who are still living in their own homes. I think this is an issue that can span it's not specific to assisted living.
Correct. Absolutely. Medication management in assisted living is a service that you can add on for an additional cost. And so, and there's several options that you can try in most communities that can allow some independence with your loved one and lengthen the time that they're able to have some control over their medications. And then there's full medication administration that your community can provide. And so I think that the most important thing for folks to understand is your loved one might be very independent when they initially move into a community or when they're in their own home. And that can transition through time to needing more assistance and support. And it can become a very serious problem for many seniors.
To segue into my next question, when I was working with seniors one-on-one, I remember going to this woman's house to do an assessment, and her pills had all been poured into this beautiful glass bowl, and it was like a candy dish. And she would just reach in there and pick out the ones that she was supposed to take. To me, that was a huge red flag. Who knew what the medications were, how old they were? So to segue into my next question, what are some of the red flags? What are some of the signs that would concern you about someone's ability to manage their own medication?
So medications outside of their original container is definitely a red flag. That's one. And I have actually seen that myself in assisted living, where I've gone into an apartment and I've seen an individual exactly like you're describing, who had poured their medications into a glass dish that was on their
pretty.
I know it's on their coffee table. Sometimes, as crazy as that might seem, it's can be a somewhat functional but dangerous situation. Some folks can tell you exactly what's in that container and why it's not in its original bottle and when they take it and how they take it. And then I always am able to bring up some other concerns from a nursing perspective, which is in an emergency situation, how would anyone else know what was in that bottle or that beautiful glass dish? And how would anybody be sure that if you weren't able to speak for yourself and say what was in that dish, how you were dispensing it and taking it? And so what can seem very rational to us as adults oftentimes can actually be a very unsafe situation for many seniors. And so we tend to do a lot of different things to try and compensate for having some difficulties in your own private home or in an assisted living community where maybe you can't get a bottle open. And so I've seen folks pour blood pressure medications into maybe a Tylenol bottle, and they'll write on it with a Sharpie pen. And the Tylenol bottle's maybe larger, and it's easier for them to get the lid off and things like that. But then there's no way to really validate, what that medication is for sure, and how often it's being taken and what the fill date was and so forth and so on. So it is really important that even as very independent older adults or younger adults that we manage our medications with all seriousness and safety, and think about scenarios outside of just our daily giving ourselves those medications. If somebody else came into this scenario, would they be able to know what's going on here? Because it's important in an emergency situation that we can identify what someone's taken and how often and so forth.
So tell me about some of the things that you've seen working in assisted living that would bring you concern, maybe some things that staff would notice that you would think, well, we're going to have to start this conversation with family or with the resident themselves.
So first off, what I think of is just really being aware of how critical it is for older adults, for everybody in that matter, but even more so for older adults, to be managing their medications precisely. They're taking medications for their blood pressure, they're taking medications for their heart function, medications for mood and cognition, and blood thinners, things for their blood sugar. And so simply taking certain medications a little bit too close together can cause a fall. And so what would concern a nurse as far as medication management would be an individual perhaps having pills on their floor. Housekeeping goes in and they find a pill or two or three on the floor or under the recliner, tucked into the cushion of the recliner. And that's not uncommon. Older adults can maybe drop a pill and not be aware of it. And so that's definitely something that staff members should be trained to look for and report to their community nurse. When older adults are verbalizing, maybe having some confusion about what their medications are for and when they take them and when they last took them, definitely brings up a lot of red flags. And then just not having a solid system in place where, if there is an emergency situation, and sometimes that's how these things come up, is in an emergency situation where you are in there with them and trying to get them some medical help, and you're not able to really determine what's going on with their medications and where they are. They can be scattered throughout the apartment, and there isn't really a solid system. And maybe even a med list or a tracking sheet or something that's going on. So, which
could be a real problem if they had to go to the hospital. They weren't in the hospital system to begin with, so there's no history of their medications. I mean, I can see that turning into a real problem.
Absolutely. And the emergency room, the paramedics that come to respond, it's really vital information for them to try to determine what is going on with this individual. And so they need to know what medications they're on, when they took them last, And so even for somebody that's very independent, if they don't have some sort of a system in place when there's a crisis and maybe they can't speak for themselves, that can be an issue even in the best situation.
Yeah.
Yeah.
So a person has a right to manage their own medications, just like they have the same rights as they do outside of assisted living as they do inside assisted living. So when you start seeing the concerns, you start to see some red flags for somebody, what are the next steps? What are some of the things that you put in place or that family can put in place to help alleviate some of that?
Inside the home, inside a private home, inside an assisted living community, there are usually options. And so once again, I always say, know what the options are in your particular community. What types of things can they do? How can they problem solve when folks are having a hard time? And ideally bring these up before it becomes an issue so that you can know what to expect and it's not a surprise. Because like I said, medication management, when the community is managing it, it's an extra cost. And then also there's wanting your loved one to be as independent for as long as they can be. And so typically there are some steps we can take prior to the community taking over medication management. And those can look like really simple things, just family coming in and filling up a pill box. Maybe AM and PM, or sometimes they get ones that are 4 times a day even. And having a med list there with their pill box that says, what's in each individual box and what they're taking and how often. Or an automated pill dispenser. Those are wonderful. And there's so many options out there nowadays that you can find online or in a medical supply store that can allow your loved one to have some extended independence. And oftentimes those systems are the only thing that's needed. You can take a few steps and invest a little money, maybe in some pill boxes or an automated dispenser. And that can ensure safety for quite a long time. Those can become an issue in situations where pill boxes, there isn't an alarm on there. And so sometimes those can be easily forgotten. I know I forget to take, my vitamins every day and I have them in a pill box. So pill boxes can be successful. They can help get medications organized and be set up by someone else. So you at least know there's the best opportunity possible. But they're not 100%. They really require somebody to be able to know. I've even had family members that have called every morning and evening to remind their loved one to go to their pill box and take their medications. And that can be really successful as well. It's very individual from person to person and family to family, what works, but there are definitely other options. But when we start to see those types of support systems fail, where possibly we're still seeing pills on the floor,
But one of the challenges we faced when we were in the pillbox phase was that not every medication could go in a pillbox because there was also powders and there were creams and there were other
eye drops. Yes.
Nasal spray.
Something that needs to be refrigerated. Yes.
So even in the best circumstances with the best cognition, not everything can go in there. So
that's a really good point. And sometimes in some communities, there can be a little bit of a crossover where an individual might be managing a portion of their medications and maybe their family has an automated pill dispenser or a pill box set up for them. And the community is maybe dispensing their powders or their really critical medication like Coumadin, blood thinners, things like that. Or eye drops. Eye drops can be really difficult for older adults sometimes if they can't get their head back or they can't get the eye drop bottle open. And so that's I'm glad you brought that up because it's another option that is sometimes going to, again, allow your loved one to be as independent as possible. Sometimes I'll see family members set up all of the individuals' vitamins and supplements and over-the-counter medications in a pill box or a pill dispenser. And the facility will, again, manage the ones that are maybe more critical, that require some monitoring of blood pressure or very specific timing. And so it doesn't have to be an all or nothing.
Yeah.
And I think that's what,
point.
a lot of us are afraid of. And a lot of older adults don't like. And so sometimes we can kind of break things up to still, again, extend some of that independence and control, but give them some support that they need for the really important medications. And so lots of options. Definitely talk to your community about that. But once you get to that point where, it's not safe, things are being dropped. An automated pill dispenser, I've seen individuals unplug them because they don't understand why they're binging or chiming. Yeah. I've seen them take batteries out. I've seen the dispensers go off, and the individual knows, hey, it's time for me to take my medication. They go take their medication out of the dispenser. They set it down, and it's on the counter, and it never gets into their mouth.
Yeah.
Other times I've seen, individuals that have some hearing impairment that maybe don't hear their dispenser go off, or they're not in their apartment if they're very active. Even with some cognitive decline, they could be out of their apartment often during the day. And when you have the community managing those medications, the med tech or the caregiver that's dispensing those medications can go out and find them. And give them their medications. And so I've also seen folks that, have vision impairment and maybe some numbness in their fingers, and they can't feel or see when they drop some of those really tiny, critical heart medications or blood pressure medications. And so even sometimes once you've tried everything to support them, you get to that point where the community needs to manage your medications.
And one more point, because we have hands-on tested a lot of the automatic medication dispensers out there. One of the things that I also find very concerning about some of the systems is that the user can dispense medications outside of their set regimen. So if you have somebody who is drug seeking, if you have somebody who really likes their pain medication, even though they shouldn't be taking it, there is definitely some concern over how much access a person can have to those automatic pill dispensers. There's only one that I know of that is FDA approved, or they might be in the process of getting FDA approved, that is really technically locked and sends an alert to a caregiver or a family member if the system is being tampered with. So just as an aside. So tell me a little bit, before we run out of time here, tell me a little bit about what medication management does look like in assisted living, and who does that? Who's in charge of this?
Yes.
Yeah.
So the nurse's role in assisted living is more of an oversight and supervision of the medication management systems that go on in that community. So it's there are some states, and it's going to vary from state to state. It can be dramatically different from California to Oregon to Washington. So the regs vary, and the regs are what the regulations are what tell that community how they can and cannot dispense medications. So, speaking from an Oregon perspective, we have unlicensed care providers that are dispensing medications here, and they go through training. They're supervised by nursing staff, and there's a lot of different regulations and policies and procedures put in place to make sure that it's a safe system for our older adults. But it's typically not, or at least not in the state of Oregon, medications being passed by licensed nurses. It's a supervision. But oftentimes the individuals that are passing those medications have been in that position for many years and are very experienced and knowledgeable. And I've definitely worked with some medication aides or medication technicians that have been as good as a lot of nurses that I've worked with. They're very knowledgeable and they've been doing it for a long time. And so there is a significant amount of training that goes into teaching an unlicensed care provider how to pass medication safely, and there's systems in place, computerized systems, and like I said, passing policies and procedures to make sure that those medications are dispensed appropriately and safely. And again, I can't say it enough times, really knowing what systems that your facility has. I mean, it's always great. How does my mom or dad or grandma or grandpa get their medications? What does that look like every day? Where are they kept? Who's going to be passing them? What kind of training do they have? You should never feel bad for asking those types of questions. And there should be somebody that's always there that's willing to answer them for you. And be connected with your nursing staff in your community. If you have questions or concerns, nurses, we want to know about it. We want to make sure that our residents are well cared for and they're receiving their medications in a timely manner, in a safe manner, and that's part of our job. That's what we're there to do. So yeah.
Anything else? Any closing thoughts about medication management?
It's something that's difficult. Be compassionate, realize that older adults have had a lot of struggles. They've had to give up a lot. Talk about it a lot. Try to support them with different options. Work with your community to see what options are available before, you're having to kind of take away that independence and freedom from them. And I think that the sooner we start to dialogue about that, and when we regularly dialogue about that and ask mom or dad or grandpa or grandma, how are you doing with your medications? Or let's talk about those today, and keeping that conversation alive so that it doesn't seem like it came out of nowhere. Because that's what can be hard, is that older adults can feel like this is one more thing they're trying to take away from me, and it's heartbreaking because for most of us, if we're blessed, we're going to be there, so just being sensitive.
Okay. Thank you. Great
You're
advice.
welcome. Thank you. Thanks for having me.
Thanks everyone for watching. If you have comments or questions, please leave those below and we'll see you next time. Have a great day.